Hi, I'm Dr. Shah. Welcome to the Weight and Wellness Center here at Tufts Medical Center. Whether you've been considering surgery for a long time or have been recently encouraged by your primary care physician to get some more information, or you know somebody who's had surgery, we welcome you to our program, New England's oldest multidisciplinary center for bariatric surgery. The purpose of this information session is to provide some general information on obesity, the rationale for treatment, an introduction to the types of procedures that we offer, and program criteria. The Weight and Wellness Center here at Tufts is among the top programs in the country. We are a national center of excellence as designated by the American Society of Metabolic and Bariatric Surgery. As a Level 1 rated facility, we are recognized for providing high-quality care, complete bariatric surgical care, and have a high-volume practice that can manage the most challenging and complex patients. What sets us apart? We are one of the largest surgical programs in New England. We have conducted more than 4,000 laparoscopic bariatric surgeries. Almost all of our operations, over 99%, are done laparoscopically, which means our patients can enjoy smaller scars, a faster, safer recovery, and less chance of infection. A full support team including behavioral therapists, nutritionists, physicians, surgeons, and nurses exclusively dedicated to nutritional and obesity-related issues. Founded in 1985, our clinic has achieved excellent results, having treated several thousand patients. We evaluate each patient's needs to create a specific treatment plan within our program. We have all heard the remarks about overweight people. They have no willpower. They eat too much. In reality, with advances in medical and scientific research, we are learning that the causes of excess weight and morbid obesity are multiple and complex. Despite conventional wisdom, it is not simply a result of overeating. Studies have shown that in many cases, a significant underlying cause of morbid obesity is genetic. And unfortunately, once the problem is established, weight loss efforts, such as dieting and exercise, have a limited ability to provide effective long-term relief. Obesity is a chronic medical disease with serious health implications caused by a complex set of factors. It has been estimated that 64% of the adults in the United States are either overweight or obese. 80% of these are women. Statistical trends in the U.S. show these numbers are rising, as are the health consequences related to obesity. For example, diabetes, heart problems, cardiovascular problems, respiratory problems. It is estimated that approximately 400,000 people die each year as a consequence of obesity and obesity-related problems, making it second only to smoking in number of preventable deaths. More than 1/3 of U.S. adults are obese. Obesity-related conditions include heart disease, stroke, type 2 diabetes, and certain types of cancer, some of the leading causes of morbidity and mortality. Obesity impacts our nation's economy by increasing medical-related costs and causing employees to miss work because of health reasons. You may find that your personal expenses have also increased due to money spent on prescription drugs, weight loss products, or other out-of-pocket medical costs. Medical professionals often use the term morbid obesity when discussing a patient's eligibility for weight loss surgery. Morbid obesity is generally defined as being 100 pounds over ideal body weight, or a BMI of at least 40 or 35 with obesity-related conditions. As the incidence of obesity continues to increase at alarming rates, it is no surprise to see changes in society's perceptions of the seriously overweight. In the past, obesity was seen as a weakness or failure of the individual. Most doctors simply told patients that they should eat less and exercise more, even though the results were less than impressive. Weight loss surgery was even viewed as a dangerous and extreme measure, even though conventional methods were ineffective, especially long-term. Today, a real change is underway. Obesity is now considered a disease state, just like diabetes, and in fact is recognized as the cause for many serious health conditions. Bariatric surgery is safer than ever before. Procedures are generally performed in under 90 minutes, and patients are usually home within 48 hours. These procedures have a risk profile similar to many commonly performed surgeries, such as having your appendix or gallbladder removed. Excess fat can lead to varying conditions based on where it's deposited in the body. Metabolic syndrome can result when excess fat is deposited around the abdomen. It is usually associated with several other risk factors for diabetes and heart disease. Unlike breaking a leg, many of these comorbid conditions that result from excess fat are silent killers. Diabetes, hypertension, and sleep apnea can result in significant metabolic changes to one's body, without the presentation of physical pain until end organ disease has already set in. Surgery works. The far majority of most weight-related comorbid conditions will improve or resolve. Some of the mechanisms are weight-independent. At present, bariatric surgery is the most effective method to achieve major long-term weight loss. The net effect is an increase in quality of life and decrease in overall mortality. The Weight and Wellness Center is one of New England's oldest comprehensive multidisciplinary treatment centers for obesity. Leaders within the field, we have always believed in the importance of a multimodality form of treatment and its role in providing the best possible aftercare and setting the foundation for long-term success. We have long understood that bariatric surgery is unique and different than other types of elective surgery, where success is less dependent on ongoing compliance to dietary or behavioral changes. Obesity is a complex disease. Although surgery provides a powerful tool, it is just one part of the journey that requires a multidisciplinary team of experts to provide the best outcomes. The far majority of individuals will not be able to achieve significant weight loss that is durable. The ongoing pattern of weight loss and weight gain associated with the so-called yo-yo dieting results in changes in body composition from loss of lean muscle and increases in fat that can have a negative impact on metabolism. Over 10 major studies have documented that the benefits of surgery outweigh the risk of staying morbidly obese. Who qualifies? You should be 18 years of age or older. Any untreated endocrine disorders that may contribute to weight gain should be ruled out or managed. Patients should not have an active alcohol or drug problem. Active smokers will be asked to quit smoking for a minimum of 2 months before surgery and remain smoke-free. Most importantly, patients will be asked to complete a multidisciplinary evaluation. Gastric sleeve surgery, also known as sleeve gastrectomy or vertical sleeve gastrectomy, is a newer but now standard form of weight loss surgery, which is increasing in popularity. The gastric sleeve surgery is a non-reversible procedure where approximately 85% of the lateral stomach is removed. The stomach then takes on a tube shape, or as the name suggests, a sleeve. The procedure has two main mechanisms of action. The portion of the stomach that is removed produces a hormone called ghrelin. Ghrelin is responsible for appetite stimulation in response to food. The resection of this area restricts the amount of food that can be consumed during a meal and also decreases the sensation of hunger. Short-term studies show that the sleeve is as effective as the Roux-en-Y gastric bypass in terms of weight loss and improvement and/or remission of diabetes. The gastric bypass has been around since the 1960s and is considered the gold standard surgical treatment of obesity because we know the most about it. The procedure has been perfected over the years and is now performed primarily as a laparoscopic procedure. Similar to the sleeve, it also has two main mechanisms of action. One is restriction. By creating a small new stomach pouch, the amount of food that can be consumed during a meal is significantly reduced. The second mechanism of action is the bypass of hunger hormones in the now separated remnant stomach. Studies have also shown increases in the level of incretins after surgery, which may be responsible for some of the anti-diabetic effects. Bariatric surgery results in significant weight loss. It may be possible to lose half or even more of your excess weight within 12 to 18 months. With this comes the prevention and/or improvement and even cure of many of the weight-related comorbid conditions, such as hypertension, diabetes, and sleep apnea. These can be life-threatening. But there are also many indirect benefits, such as improved quality of life, the impact of which is appreciated not only by patients, but can extend to entire families. There is structured ongoing follow-up for life with all members of the team. Vitamin labs are obtained more frequently during the rapid weight loss phase and then annually from year 2. Plastic surgery is a personal choice and may not be covered by insurance unless it's deemed medically necessary. It is generally not recommended until patients have reached their lowest weight and have been weight stable for 3 to 4 months. We are fortunate to have a group of plastic surgeons who are very experienced with body contouring after extreme weight loss. It is strongly advised that women of childbearing age use the most effective forms of birth control during the first 12 to 18 months after weight loss surgery because of the demands pregnancy places on your body and the potential for fetal damage. While the operations are a very important piece of the puzzle that will help you to get healthier, they are only one part of the process. You will soon have an incredible tool at your disposal to help you fight a disease that at this point has been overwhelming. In order for you to achieve success, you must know how best to use that tool. This is where the team comes into play. The multidisciplinary team, which includes behaviorists, nutritionists, and surgeons, will help you prepare for the lifestyle and dietary changes necessary for optimal success. In addition, most insurance companies will require that patients meet with a multidisciplinary team as part of the approval process. Be prepared that this process can take anywhere between 3 to 6 months, or even longer depending on your insurance. Just remember, you will not have to go through the process alone. A team of professionals will be there to support your efforts. Which type of weight loss surgery is best for you depends on your specific situation. Your surgeon will take many factors into account, including your body mass index, your eating habits, your health problems, and any previous surgeries. Surgery is just the first step into the lifelong journey of a healthy and happy lifestyle. Thank you for taking the time to get more information on weight loss procedures here at Tufts Medical Center. We look forward to meeting you soon.